As we journey through life, we all reach moments when we start reflecting more on what the future holds. It's natural to wonder how we'll know when our time is drawing near. While the process of passing away is something we all face, there are certain warning signs, subtle signals the body gives us, that can indicate the final stages of life. In this video, we'll talk about 12 important signs that could suggest the end of life is approaching. Understanding these signs can be crucial, as it allows both the individual and their loved ones to better navigate this challenging time. Recognizing these signals can help ensure that people receive the best care and emotional support possible as they approach the final stages of life. Remember, some of these signs are natural and not always signs of imminent death. It's important to stay aware and seek medical guidance to understand what's happening and make informed decisions. Let's walk through these warning signs and what you can do to help. Sign 1. Decreased appetite and thirst. One of the most common signs that the body is preparing for the end of life is a decreased appetite and a lack of thirst. As the body begins to conserve energy and prioritize essential functions, the need for food and water naturally decreases. This often manifests as difficulty swallowing or a loss of interest in eating or drinking. For example, Maria, an 85-year-old woman suffering from advanced heart failure, stopped feeling hungry and began rejecting even her favorite foods. Her family became concerned when they noticed she was drinking less water and growing weaker. After consulting with her doctor, they learned that her lack of appetite wasn't just due to her disease progressing, but also mild dehydration. To help someone like Maria, doctors often suggest offering small amounts of fluids like warm infusions and easy-to-swallow foods like purees or jellies. While the appetite may not return fully, these adjustments can provide comfort and hydration. If you notice a decrease in appetite or thirst, it's important to consult a doctor to understand whether this is a reversible condition or part of the natural process. Sign 2. Reduced energy and weakness. As we approach the end of life, we often experience a reduction in energy and persistent weakness. The body starts to conserve its final energy reserves, and this can leave you feeling constantly tired, even after resting. Simple tasks like getting out of bed or taking a short walk may feel exhausting. Though this can be difficult to deal with emotionally, the good news is that in some cases, this energy decline can be reversed with proper care. If the cause is treatable, such as anemia, dehydration, or nutrient deficiencies, appropriate medical intervention can help restore energy levels. This might include vitamin supplements, hydration therapies, or adjustments in medication. If you or a loved one is experiencing significant fatigue and weakness, speak with a healthcare provider to determine the underlying cause and explore ways to improve comfort and energy. Sign 3. Drop in body temperature. Another warning sign is a drop in body temperature. As the body reduces blood circulation to conserve energy for vital functions, the skin can become cold, pale, or even bluish, especially on the hands and feet. This decrease in temperature can lead to discomfort, but it's a natural response to the body's reduced functioning. In many cases, this temperature drop can be managed with measures like extra blankets, warm baths, and drinking hot liquids. However, if the drop in temperature is accompanied by other symptoms like fever or chills, it's important to seek medical attention to rule out infections or other treatable conditions. Taking steps to keep the person warm and comfortable can greatly improve their quality of life during this time. Sign 4. Changes in urine and kidney functions. When the body prepares for the end of life, kidney function begins to decline. This can lead to changes in urine production, such as decreased output, dark urine, or even fluid retention, where the body holds on to excess fluids, leading to swelling in the feet, legs, or abdomen. Other signs to look for include foamy urine, which can indicate protein in the urine, or reduced nighttime urine production. It's important to monitor these changes closely, as they may signal kidney failure or dehydration. In some cases, kidney function can be improved with medical treatments like fluid management or dialysis. However, these changes also signal the body's natural decline, and it's important to manage the person's comfort and well-being in consultation with a doctor. Sign 5. Changes in mood or behavior. As the end of life approaches, some individuals experience sudden changes in mood or behavior. This might include increased irritability, anxiety, or depression. In some cases, people may even express feelings of preparing for a journey, packing their bags, or talking about going on a trip. This change can be the result of physical factors like hormonal imbalances, chronic pain, or chemical imbalances in the brain. In these cases, there may be medications or therapies that can help alleviate some of the emotional distress. For caregivers, it's important to provide a peaceful environment, validate the person's feelings, and offer emotional support. If these changes are affecting the person's quality of life, speaking with a healthcare professional about appropriate interventions, such as pain management or counseling, is crucial. Sign 6. Decreased sensory functions. As the body prepares for the end of life, many people experience a decrease in sensory functions, such as loss of hearing, vision, taste, or touch. The body naturally begins to prioritize its most essential functions, like breathing and heartbeat, leaving less energy for sensory processing. This decline in sensory function can contribute to feelings of isolation or confusion. However, it's important to note that in some cases, sensory decline can be caused by treatable issues like vitamin deficiencies or infections. Regular checkups can help identify and address any underlying health problems. While some changes in sensory function are a natural part of aging, it's important to ensure that the person remains comfortable, well hydrated, and has adequate sensory stimulation, whether it's through music, soft lighting, or the presence of loved ones. Sign 7. Alterations in consciousness. As life draws to a close, many people experience alterations in consciousness. These might include excessive sleepiness, mental confusion, or disorientation. It's common to see moments of lucidity interspersed with periods of unconsciousness or a state of calm tranquility. These changes can be caused by chemical imbalances in the brain, lack of oxygen, or infections. For example, a woman facing advanced cancer may have moments of confusion, but she might also experience moments of peace and awareness, expressing feelings of gratitude and acceptance. If you notice such changes, it's important to maintain a supportive presence and provide comfort. Let the person know they are not alone, and that their comfort is the top priority. Speak to their healthcare provider about any concerns and how best to manage these moments. Sign 8. Changes in breathing. As death nears, changes in breathing patterns become more noticeable. You may observe rapid, shallow breathing followed by pauses, a pattern known as Cheyne-Stokes breathing. Other signs include agonal breathing, where the person struggles to breathe and exhibits labored breaths. While these changes can be unsettling, they are part of the body's natural transition. In some cases, medical interventions can help ease breathing difficulties and ensure comfort during this stage. If you are caring for someone at this stage, it is important to stay calm and ensure they are as comfortable as possible. Using warm blankets, a sense of detachment. As the end of life approaches, there may be a growing sense of detachment. People may become less aware of their surroundings and exhibit a disconnection from their own body. This feeling can bring a sense of peace, as if the person is preparing mentally and emotionally to move on. This is a natural part of the dying process. As the body conserves energy, the mind also begins to slow, and the person may experience a release of tension and an acceptance of what is to come. For loved ones, recognizing this detachment can help create an atmosphere of calm and support, allowing the person to move through this process with dignity and peace. Sign 10. Difficulty communicating. Communication becomes more challenging as death approaches. You may notice that the person has difficulty speaking clearly or expressing their thoughts. This can be due to physical weakness, affecting the muscles used for speech, or due to cognitive decline. It's important to remain patient and find nonverbal ways to communicate, such as through gestures, facial expressions, and eye contact. If the person is unable to speak, try to understand their needs through these cues and offer comfort. Sign 11. Unexplained weight loss. Unexplained weight loss can be a significant indicator that the body is starting to shut down. When the body is running low on energy, it begins to consume fat and muscle to maintain essential functions. This is often a natural process, but sudden or rapid weight loss should be monitored. In some cases, weight loss can be reversed or stabilized with medical intervention, nutritional support, and treating underlying conditions. If this occurs, seek advice from healthcare professionals to address the issue early. Sign 12. Appearance of spots or rashes on the skin. As the body prepares for the end of life, you might notice changes in the skin. This includes the appearance of age spots or rashes, often due to the body's decreased ability to process toxins and circulation slowing down. These skin changes can also be a sign of organ dysfunction, so it's important to seek medical advice if they occur suddenly or are accompanied by other symptoms. Conclusion: the body is always sending us signals, and understanding these 12 warning signs can help us prepare for the inevitable. Recognizing these signs and acting with compassion, care, and the help of healthcare professionals can ensure that loved ones receive the best care during this delicate time. If you found this information helpful, please like and share this video with others who may need it. Subscribe for more insights on life, health, and well-being. Thank you for joining.